Hello, my name is Ashley Valentine. I'm co-founder and president of Cells, and today I will be talking to you about the work we did with Avalere Health called Advancing Care for Sickle Cell Disease, a Strategic Roadmap. So we all know in this group that sickle cell disease historically has been deprioritized, has been marginalized, and sometimes we even say it was a forgotten disease. But right now, we are in a renaissance period for sickle cell disease where there have been great advancements in innovation, and there's been many efforts to improve care and access to care. So given this backdrop, Six Cells partnered with Avalere Health to convene a multi-stakeholder roundtable. So a group of individuals across the healthcare spectrum to discuss innovative approaches to improving quality of care and access to quality care for people living with sickle cell disease. Now, this group was pretty historic because we worked really hard to convene sickle cell warriors and caregivers to provide the real world perspective of healthcare in this country, as well as patient advocates, government officials who at the time of the roundtable and currently were working really hard to try to get more funding into sickle cell disease to improve programs and understanding of the condition at the federal level. We also convene payers, manufacturers, researchers, and medical professionals. And for some of our stakeholders, this was either the first time they were directly speaking with individuals living with sickle cell disease or their caregivers, or this was the first time that they were part of a group like this where all of the stakeholders or most of the stakeholders who were involved in healthcare were at one roundtable. So a little timeline of the projects. There were three main phases. So first we did an environmental scan, and then we created this care continuum map that we used to guide our discussion. And then we had the roundtable discussion about the care continuum map and other themes identified in during the environmental scan. So the environmental scan and the care continuum was an effort that we really worked closely with Sick Cell ambassadors to ensure that we were capturing the patient experience and the caregiver experience. So first we did a great literature review of the current resources for sickle cell disease. We also discussed that with this task force of ambassadors to include their oral testimony and accounts of life with sickle cell disease. And then based on our findings, the team developed this sickle cell disease care continuum map. And, we really tried to highlight that care for sickle cell disease and for people living with sickle cell disease is complicated and requires consistent and multi-stakeholder coordination. So it's not just one specialist or one hospital, but it is an array of services and professionals in order to maintain a high quality of care and to maintain someone's life living with sickle cell disease. And we also identified the top barriers to accessing care. So they were systemic racism, inadequate or delayed pain management, suboptimal transition from pediatric to adult care, the lack of primary care knowledge of sickle cell disease, and inconsistent insurance coverage throughout the lifetime of someone living with sickle cell disease. So here is a snapshot, or here's a picture of the care continuum. So you can see that it's complex and requires many types of specialists, many types of individuals to work to take care of someone with sickle cell disease. And we were able to capture most of it in this map. And if you look at the sides, it says referral loop back to hematologist. We tried to capture broad themes that were across multiple spectrums or multiple areas in the care continuum map here. Now, the roundtable took place November 12th, 2020, and you can see here from the picture, from the colors, the diversity of stakeholders that we had at the roundtable. So first, thank you to everyone that attended. And secondly, just as a participant and a moderator, it was really exciting to hear the level of discussion coming from each of these groups and each of these stakeholders about sickle cell disease. Now, the roundtable had three breakout sessions. And so the sessions were defining quality and value from the sickle cell disease perspective, understanding the opportunities for evidence generation and the impacts of racism and stigma and discrimination on access to care for people with sickle cell disease. And from there, we were able to develop this roadmap to advance sickle cell disease care. And so we try to bucket out all the themes and topics covered into these four broader topics. So, provider support and education, delivery and innovation, evidence generation, and then health policy and advocacy. So each of these stakeholders or each of these stakeholder groups have specific recommendations, but also a lot of the recommendations cross stakeholder groups in order to improve care for people living with sickle cell disease. So some of the conclusions that were drawn from this roundtable is that while there are challenges to advance care for people living with sickle cell disease, there has been improvement. There has been successes in ensuring that people with sickle cell disease can get quality and care. So it's important for us to take those best practices and try to implement them across the US. The other main conclusion is that a multi-stakeholder approach is needed. So what was really interesting for us is hearing from payers in addition to hearing from some of the caregivers and the patients, because we could see that during the roundtable, one was not understanding what the other was going through, but through conversation, we were able to identify, oh, that's a barrier. Therefore, we probably need to fix it. So we see a lot of opportunity to continue doing this type of work. And we now have a deeper understanding that it does require a multi stakeholder approach when coming up with solutions for people living with sickle cell disease. So we have recommendations in the roadmap for healthcare providers, for community-based organizations and advocacy groups, for public and private payers, for federal and state government agencies, for research organizations, professional societies, and for manufacturers. And here is a picture of the publication, and the full publication is available on our website. You can download it, and if you email us upon request, we can also send you a printed version if you do not have access to our printer and you would like a copy of this. Thank you so much.